Hi, everyone. Thank you so much for joining us today. My name is Raif Darazi. I am your host, and I am joined by the wonderful Brandon Kennedy, a mental health therapist. Today, we are continuing our HIV in View series, which we had some incredibly great discussions at AIDS 2022 in Montreal. And today, we're talking about mental health as it relates to living with HIV and the stigma that is involved. Mental health and HIV are like interlinked. They can't be separated. And it's so important that we have this discussion because so many people struggle with this. Tell me, what is your experience in regards to stigma and HIV and the impact that has had on your mental health?
I think thinking back, I've been positive now since 2010. So I was diagnosed June 2010. And there were a lot of things, a lot of questions related to a lot of things that we easily much more have access to now. And some of the stigma was like, okay, so what does medication look like? And even if I get the medication, where do I put it at in the bathroom? Is it something that I keep hidden? A lot of those other different types of things. But also, I think one of the biggest things that it brings to light is stigma surrounding what it looks like for healthy dating and relationships, even familial ones. Can I be upfront and honest and transparent with my family, my friends surrounding what it is that I'm going through and worrying about what their reaction would be. For myself, I have had a very supportive family and friend circle. And I think a lot of things surrounding stigma in my own experience really relates to what having a healthy support system looks like.
And people living with HIV deal with mental health on a different level with the stigma that's involved. Can you tell me a little bit more about how that plays into people's mental health and having to also deal with not just day-to-day rigors and stressors, and like we've all been dealing with COVID and all of those things, but that added layer of stigma in addition to trying to just be a healthy person?
Rafe, one of the first things that comes to my mind when we're talking about HIV and mental health is that initial onset of trauma that some people might encounter, finding out the news that you have seroconverted and you are now HIV positive, and just kind of letting that sink in, I think is one of the first steps. I think for a lot of people, they need to wrap their brains around the area of acceptance and accepting that this is the diagnosis. And once they've gotten to the place of acceptance, I think then they're able to go to the places of, well, how do I reaffirm myself? How do I reaffirm my place in society? How do I reaffirm myself with some of those familial relationships? If people are fortunate enough, they might have that level of a support system of a good friend that they can talk to, they can open up with as well. But some people don't. And if you have some resources such as mental health counseling or maybe even life coaching, I think that having some linkage to care, which is what we would usually call it, having some linkage to care referrals for mental health counseling to get to that place of acceptance or to get to that place of what reaffirming what life looks like right now can be really beneficial. But also, in addition to that, one of the things that personally I like to say is that I'm not living with HIV. HIV is living with me. I think it's about having some sense of control. It's like, it's not the driver. I'm not making all of my decisions surrounding what HIV says that I should. I'm making the decisions that I need to make for me first. And
That's right.
HIV is still fitting inside of that pattern.
Exactly. Very well said. I would say that the number one thing that people come to me about when they're struggling with HIV is the mental health aspect and dealing with depression and suicidal ideation and you name it. Part of dealing with a diagnosis is kind of, as you were saying, redefining your relationship with the virus and your relationship with yourself and what that means for your life moving forward. So do you have any advice that you can give? I mean, yes, in an ideal situation, we are able to get a therapist and be able to talk to someone on a regular basis and really deal with this. But for so many people, it's like, all I can offer is one piece of encouragement or one piece of advice for them to move forward. Is there anything that you can offer people who are just on their own and struggling and they can kind of take with them to help deal with redefining their relationship with HIV?
Yeah, absolutely. two things come to mind, right? The first thing is we are talking about something that is a medically related issue, if you will. And I think having a really good intimate relationship with your primary care physician or your infectious disease provider is something that I would say hands down is one of the very first steps that a person should take in terms of trying to better understand the virus, trying to understand what transmission looks like, trying to understand what protection now looks like, et cetera. And also to have the information to inform what that looks like with other partners if a person is still going to continue to be sexually active. I think having a great relationship with your medical provider is probably like the top number one. It helps you to really become engorged in what HIV looks like for you. But in addition to that, the second thing, I think oftentimes people think that we need this wow factor outside of the box, idea of what it looks like in terms of moving forward. But one of the things I always encourage people to do, and I even did myself, what is it that used to make you happy? What things were you doing on a regular basis and kind of coming up with some sense of routine to allow time to process and to get used to what now life looks like. And I think oftentimes people find that their lives haven't really changed too much. They just need to continue to do some of those core staple things that they were already doing as they always have, that bring them a sense of joy, that bring them a sense of contentment, that bring them happiness, and also that help them to feel supported. And those are like the top two things that I would encourage. Have a really great relationship with your medical provider. And one medical provider is not the do all be all end all to medical providers. If you find that your relationship with your primary care physician or your relationship with your new therapist is not really working out and there's not a good sense of synergy, it is totally okay to shop around. Do those initial consultations with the medical provider. Do those initial consultations with the mental health therapist. Double check and make sure that their approach to what a healthy life looks like post-diagnosis is also something that resonates with you. And you just kind of get the good feels from it.
Yeah, I totally agree with you when you say that education and having that connection with your medical healthcare provider is so important, because a lot of times that will directly impact your perception of yourself and what's possible. I remember when I was diagnosed with AIDS on my 27th birthday. And I was like, okay, well, I'm going to be dead in 2 to 3 years. So, bring it on. I don't know, like, what do I do at this from here on out? I don't know. I just got to figure everything out. And everything kind of just fell apart for me. And so a huge boon for my self-worth and self-esteem was just realizing that I was going to live, and that not only was I going to live, but I was going to be extremely healthy. And that's so empowering to know that and to believe it.
Having a good sense of self-awareness surrounding what HIV looks like from the medical provider standpoint, it totally directs a lot of things like, how do I engage sexually with new partners? What does that look like? How do I engage with disclosure? I think you only get to some of those different things when you get to a place where you've a little bit more better understand what HIV is and what those transmission rates look like and all those other different things.
Mm-hmm. Okay, so we've talked about how we can empower ourselves, be our own best advocate for sure. Now, how do we, moving forward into the world, engaging with the world, what can we do to help reduce the stigma that has such a profound impact on our mental health?
Somebody just said that, like, the best thing I think that we can do is use our voices. And I know that it might sound very colloquial, but I think that oftentimes we have these experiences that we have, and selfishly, sometimes we keep those experiences to ourselves. But there are other individuals and people out there that not only through us expressing our stories, they have the opportunity to align with us, or they have the opportunity to somewhat become empowered or aware just about what's going on with the individuals that are surrounding us every day. And as an advocate, not only for mental health, but also as an HIV positive advocate, I had no idea just how powerful it was just for me to share my story. I remember the first time that I shared my story, it was 6 months post-diagnosis. And I was at a discussion panel that I randomly got asked to do. I had expressed an interest in wanting to do some advocacy, but I totally wasn't ready yet. Somebody didn't show up and somebody was like, hey, you said you want to do this. So tonight's the night. And I was like, whoa, wait. Right. So I did that. And people found me on Facebook. I had all these random like inbox messages like, I'm so happy, or it's so nice to see somebody who looks like me speaking up about this. And at the time, there were only, I think, maybe 4 HIV positive African-American advocates that were under the age of 24 in the entire country. that were doing anything like that.
Yeah.
And then, it was like, CDC or USA Today or Pause Magazine, all these other different publications, they just kind of came out of nowhere. But it allowed me to realize just how powerful it could be just for me to share my truth and to share my story and share my experience. So I think one of the things I would advocate for anyone to do in your own time, when you get that moment, you don't necessarily have to get a microphone, but share your story with your friends, share your story with your family members, share your story with your other close loved ones.
Yeah, I think that's one of the huge things that kind of saved me very early on. Was I created a support system in sharing with my family and with my coworkers and my friends. I kind of just, spilled the beans to everybody. And that really proved to be really helpful in moments when I was struggling and feeling tired and not feeling my best. I had those people to lean on. And I had
Do you feel that
same, go ahead.
No, I was just going to ask you, do you feel that by sharing those experiences that it kind of helped to somewhat normalize what that HIV experience was looking like?
Yeah, there was a lot of like reminding the people around me that I am okay and I am going to be healthy. And so there was there definitely felt some reticence around that the issue of kind of like accepting that I'm going to be good. And then once people kind of came to terms with that, then it was like, yeah, it helped to normalize things. And it allowed discussions to be had where, people could learn, and where if there was stigma, even unconscious bias, that kind of dissipated.
It's like the shock value aspect of it somehow goes away over an extended period of time. I think one of the things about HIV, same as with like HSV, et cetera, is that sometimes you may not necessarily see something just obvious and apparent that is related to this diagnosis that this person got. And I think that it seems like over time, eventually our friends and family, it's like, oh, you know what? I don't see anything that reminds me of it, X, Y, and Z. And then it helps to create more room once that initial shock value has kind of settled in.
It's funny that you say shock value, because I tend to have a little bit of a dark sense of humor. And I used to bartend. And so with my friends, I would start to make these like dark jokes about living with HIV. I won't repeat them here because we're going to keep it like friendly and nice. But it was shocking to say the least. And people would be like, oh my God, Rafe, like you can't say that. And I'm like, your reaction to this is the issue. Like I should be able to joke with you, and it should be able because I'm comfortable with it. And eventually they became comfortable with that, almost too comfortable. And I'm like, okay, only I can joke about it. But yeah, so that's all those things that help.
Yeah, and you bring up another really good point. I think that in a lot of situations, and I even tell my patients this, regardless of who it is that you're talking to, how it is that you've come to terms with your status is usually also apparent when you engage and how you choose to engage with other people surrounding the topic. Like, for example, if you're in an intimate relationship with someone and maybe you've gotten to a place where you're needing to get to that disclosure, or you're courting someone and you've gotten to that place where disclosure has probably come up in conversation. If you approach it with, well, hey, I really got something important to tell you. And oh my God, I don't know how you're going to feel about this. I really hope that you still like me after I tell you this thing. And oh my God, it's so hard to say this thing. If you approach the situation with that sense of, or that lack of confidence, oftentimes the way that you give it is the way that it's received. And then that person is probably looking to say, oh, well, how can I trust that you may know everything that it's going to take to potentially protect me if I don't know if this is also what the presentation looks like? And I think, again, it goes back to some of those initial foundational things. Like, have you gotten to a place where you have truly accepted your status, and not only accepted your status, but accepted who you are today with that status as well, too? And I think once you've gotten to that place of confidence, you're not as worried about disclosing your HIV status and fear of what rejection may look like, et cetera. Rejection is something that we all deal with on a regular basis. But at the same token, I think when you've gotten to that confident place, it's like, oh, okay, that's not really for you. Or, okay, maybe this person might need a lot more education than what it is that they're willing to allow me to offer. I think confidence in your HIV status definitely helps to set a tone with a lot of different things.
Yeah, it's really about owning your diagnosis and owning your status, owning yourself, and not being apologetic about it.
Yes, very unapologetic about it.
So overall, what would you say are the foundations of achieving positive mental and emotional well-being? I know you've touched on some, but just to summarize it.
going back to recap, I think a lot of it is about having a very healthy relationship with your primary care physician and your infectious disease doctor. If they are not one and the same, for most of us, our infectious disease doctors becomes our primary care physician in some ways. So I think having a great relationship with your primary care, and absent of that, again, just getting back to some of those humble grassroots of some of those things that you used to like, that you used to tap into, and not only just doing those things, looking at other ways that you might be able to expand upon those things, joining like, a meetup group or getting on some different Facebook groups, meeting other people who also share in some of those same things. But also at the same token, we live in this big, beautiful world that is just ready for us to go out and explore. I think a lot of it is just about getting to the place where you're ready to go and try something new, try something different, and seeing how it is that it incorporates into your life post-diagnoses.
All right. Thank you so much for joining me in this conversation today. Brandon, it's been a pleasure. Thank you for sharing your personal experiences. And I hope that you've all had something to walk away with on Mental Health Awareness Day that will help make your day a little bit brighter. Cheers, fam.